Hi, I'm Dr. Scott. I'm going to talk to you about how to do a root canal treatment. Your dentist, when they do a root canal treatment, usually does it in 2 or 3 appointments. Appointment number 1, they put lots of numbing in to make sure the tooth goes to sleep and you don't feel anything. Then what they do is they drill a little hole in the top of the tooth, which gives them access to inside the tooth. Then they flush out the nerve from inside the tooth, and they usually measure to see how long the tooth is. Then, once it's all been cleaned out and sterilised, we then put a medicine down inside which helps to relax the tooth and it helps to draw out any infection or pus that's there. We then put a little temporary filling on top of the tooth and we let that just settle and we let the tooth heal up for usually about 2 weeks. After 2 weeks of allowing the tooth to settle, we then get you back in to finish the treatment off. And what that means is we put lots of numbing in to make the tooth go to sleep again. We then use our drill to clean out the tooth and we also flush out all the medicine that was left in there. And we just double check that there's no more pus there. We then sterilise the inside of the tooth and make sure it's really clean. Then we use a special compound called gutta percha, which is like a rubber, and we use that to fill the inside of the canal, because a canal, even though it sounds like it's straight, actually has lots of little corners and edges to it. So we really want to make sure that it's fully condensed and fully filled up. Once that's all done, we then use a little Bunsen burner to seal off the very top of the rubber. We make sure it's all sealed up nicely. We then put a filling right on top to cover and protect the tooth. After that's all done, we then like to give you some advice about whether or not you're going to need a crown on this tooth, because root canals tend to make the tooth a little bit more brittle.